Hello, welcome to the first of my Thursday Toast Talks, where I'm going to try to explain a bit about historical illnesses, diseases, what was meant, why they were important, and things. The first one I thought I would do is going to be about the heart. So it's going to quickly run through what's meant by heart failure, heart attack, and cardiac arrest. A quick note of caution I'd like to add is that this is not intended as medical advice and isn't representing current medical practice. What I'm intending to do with this is to get across some of the concepts from history so that you can better understand things when you are going through a book or reading about a biography and it talks about somebody's ill health. I would advise people to seek professional assistance if they have any questions or look for advice, and to also use reliable web sources. For example, the NHS websites are a good place to go if you want to find stuff out. Do not rely on random people on YouTube. Do not rely on random websites. Remember that anyone can put up a website, anyone can put up a YouTube video, anyone can edit Wikipedia. So I'm going to talk about three different terms you may hear going through which relate to the heart. The first one is heart failure. Now, that's not, as one might think, a complete stopping of working. It doesn't mean the heart is not beating anymore. It just means it's not working as efficiently as it should be. A better term would be insufficiency. So generally, this is due to the heart muscle not working as well as it should. There are other causes of these sorts of problems, and the effect of heart failure, so the heart not beating as much as it or as well as it should be for any given state, it can leave a person with reduced function or reserve, or it can kill you. Next is a heart attack, which is referred to by medical professionals as a myocardial infarction. Now, this is a fairly modern concept since we've developed diagnostic tools, really, and in fact, the definitions have changed over just the last 20, 30 years as we've got better ways of looking into this. What we're talking about here is a sudden stoppage of blood flow to some or all of the heart being mostly muscle. Most commonly, this is due to a blocked artery, and if it doesn't lead to death, it can lead to damage to the heart muscle and then heart failure. The third thing is cardiac arrest. Cardium, cardio, cardiac, all meaning just really the heart, myo meaning muscle, so myocardial is just heart muscle. So cardiac arrest is when the heart completely stops beating or just isn't pumping blood around the body at all. It's kind of a mode of dying or death. So it's how, somebody is dead when their heart stops beating. It is not a cause of death necessarily, and the cause of the cardiac arrest would be the cause of death, whether that is running out of oxygen because somebody is strangling you, whether it is running out of blood because somebody has stabbed you and you have exsanguinated, another nice medical term. Exsanguination just means leaked all the blood out, or whatever. So yeah, those are the three which we'll go over in the next couple of slides, but hopefully that will be enough to get you started. So the first thing to talk about is heart failure. Now, this is a slightly complicated thing, probably because it's not actually a great term for what we mean as medical professionals when we use the term. So the heart is mostly a muscle, and it contracts and relaxes in the same way as when you see somebody kind of flexing their biceps, you get a sort of, relaxation contraction, it moves. Exactly the same thing is what your heart is doing, and in doing that, it pumps the blood out of the heart and around the body. This is done through bits of plumbing like one-way valves and the like. The blood then carries the oxygen, nutrients, and everything else around the body. So if the muscle is damaged or stops contracting as well, or really something else stops the things being as efficient, then the heart's going to have to work harder to get your body what it needs for any given state. So if you're sitting there still, your heart's going to be going as if it's beating as if you were walking. If you're walking, it might have to respond in the way it would in a healthy person as if you're going for a run. That means if you're going for a run, it's as if you're sprinting or something. So that's where the kind of disability thing comes in. Treatments for this there are lots of them. It's these days a condition with a lot of treatments, options and things, but in the past, not so much. So the problem with the use of heart failure as a diagnosis, particularly when one's looking back into the past over, say, more than 100 years ago, is that the symptoms, the things you might expect from it, are really quite vague. So you get short of breath, and that's because your body, to try and get more oxygen into the system, to get around the body, is trying to just get more into you so that it so that the heartbeat is in effect more effective by just trying to slightly increase the oxygen in the blood. The other thing you can get is swelling or edema. Now the problem is you can get that for an awful lot of reasons. This is, most people will experience at least a little bit of this if you've been on a long haul flight or been on a long car journey. Your ankles get a little bit swollen. And in people with more severe things like heart failure, but as I say, lots of other conditions, the combination of the lower pressure returning the blood and the effects of gravity mean that the heart is unable to pump as strongly, so that sort of return in the circulation is not enough, and so the blood effective, or the fluid at least, pools somewhere, and that tends to be the bits that are most affected by gravity, hence ankles and legs. Now the problem is these two sorts of things can be caused by all kinds of other illnesses, particularly as they get worse. So, as I say, before we have fairly modern types of medicine, I would be highly suspicious of somebody being diagnosed with this, because it could just as easily be due to kidney problems, infections, all sorts of things. So the next thing to talk about is a heart attack. The medical term for that is the myocardial infarction. So myocardium, heart muscle, infarction, death, particularly because of a lack of blood supply or oxygen to the bit of the body we're referring to. And if we're thinking about heart failure, dead muscle doesn't work. So the commonest cause of this is going to be a blockage of one of the arteries that supplies the heart muscle with its own oxygen and things, although there are plenty of other causes. Unfortunately, for reasons, the heart doesn't have a particularly good supply that can cover for problems developing suddenly like this. So a blockage will tend to cut off that bit of the body, or that bit of the heart muscle completely, and so it dies because it's being strangled. The gradual blocking up of an artery can be overcome either with the other blood vessels getting bigger and kind of increasing their flow and taking over, or kind of new blood vessels developing, but it may not be as efficient, and that can lead to heart failure. Now, it's because of this kind of sudden blockage that we're thinking of that heart attacks are an emergency, because we want to try and reverse that. But obviously, until relatively recently, we were unable to really do anything about that. The third term that you may hear is cardiac arrest. Now that means that the heart is no longer pumping blood around the body at all. It's essentially not compatible with life. It can be due to anything that's causing the heart to fail and stop working as a pump. So that's because you're in heart failure, so the heart is just not beating. The muscle has got so efficient that it's just not beating. And that could be a gradual or a sudden thing that comes on. It could be that you've run out of oxygen because, as again, somebody's strangling you or you're drowning. It could be because you've run out of blood going around your body because somebody's stuck swords in you or something. All kinds of reasons. This is where, in films and TV and things, CPR is performed. Discussing CPR is a different talk, I think. And if you can reverse the cause of this, you might be able to get the heart restarted. That's the idea of that. So, getting on to the kind of more technical side of things, a cardiac arrest is one of three things when we're digging into it. You can have what's called asystole. That's when there's no movement and the heart is made to work by electrical activity, and there's no electrical activity being seen either. This isn't actually a flat line. It actually gives a sine wave, which is the kind of wavy up and down line. On a heart monitor, the flat line generally means that you're not plugged into the machine properly. Another thing you can get is called pulseless electrical activity. This is where there's an electrical trigger that should be causing the heart to beat and give you a pulse, but for whatever reason it isn't. Now, the heart might twitch a little bit, but it's not working properly, and so that would be what you might get if, as an example, somebody was, in inverted commas, bled out, and that would be potentially reversible if you manage to get enough fluid into them. But, essentially, the heart is being told to beat, and for whatever reason, it isn't working. The last one is if the ventricles of the heart, so the ventricles are the bits of the heart that actually act as the main pumps, are fibrillating or doing something like that. That is, they are going kind of nuts. There's two types of this. There's ventricular fibrillation, which is when it's just chaotic, crazy activity all over the place. And there's ventricular tachycardia, when it's just going so quickly that it's just totally inefficient. This is like a car vastly over revving, way beyond the red zone and into it just stops. These both have electrical activity. You can see on a monitor, but they are not normal electrical activity, and so they're not getting the heart to beat in such a way as to generate a effective heartbeat contraction. So yeah, and that's the only one where those paddles things work with using electricity to get the heart started again.